Korean War officially ended with the Artemis signed in 1953, the citizens believed all would be well. However, this reality was far from true. When the 625 Korean War ended, the aftermath was devastating. Infrastructures, farmlands, and factories were all destroyed. An economic collapse led Korea to be one of the poorest countries in the world. Not only in economic ways, but the war also violated the rights of numerous Korean citizens, both physically and mentally. Many were displaced, injured, and disabled, which increased the demands for healthcare. Due to these tragic consequences, in the early 1960s, under Park Chung-hee's regime, South Korea embarked on an ambitious industrialization plan that transformed the nation's economy. The government focused on rapid development, prioritizing heavy industries like steel, chemicals, and shipbuilding. While the country experienced unprecedented economic growth, the workers bore the brunt of the cost. Long hours, poor wages, and unsafe working conditions became the norm. Citizens' rights were heavily restricted, and strikes occurred, as the government prioritized industrial progress over citizens' rights. The resulting wealth from this industrial boom, however, largely benefited the elite, leaving the working class struggling for basic rights and dignity. Among most this violation of rights, healthcare was a prominent ignored right. Citizens of South Korea experienced the wealth gap and discrimination in medical services due to wealth gaps. In order to get aid, huge amounts of money were needed, which many citizens lacked. Only the wealthy were able to access medical services, leaving the poor to die out due to financial issues that kept them back from having access to medical services. In the 1950s, South Korea was facing hardships from the aftermath of the Korean War. Yet, the healthcare system was in a state of crisis due to the absence of a system for national health insurance. The absence of a national health insurance system meant that accessibility to medical care was largely determined by a citizen's ability to pay, rather than by medical necessity. This did not ensure or guarantee citizens' right to access medical care, leaving many people without access to proper medical care, eventually leading to devastating consequences for the poor class. Families would watch their loved ones suffer, unable to afford even basic medical treatment. In this tough situation, where citizens' rights were continuously being violated, the responsibility of the Korean government followed. Surge of the politics required a responsibility for health advancement. The government started to take actions, recognizing the urgent need to address the healthcare crisis and protect its citizens. The Korean citizens wanted an affordable healthcare system, a system they could rely on, one that could uphold healthcare standards and grant every citizen and worker the right to healthcare regardless of their income or job. As citizen and worker movements continued to persist, President Park Chung-hee recognized the need to address the health and working rights of the citizens. To achieve the citizens' wants and the nation's goal, Park Chung-hee decided to start mapping out the fundamentals of a national health insurance system. In December 1963, the first step was taken with the enactment of the Medical Insurance Act, allowing companies to provide voluntary health insurance to employees. However, due to the weak economic conditions and uprising complaints about the unfairness and discrimination of the workers and citizens, this Insurance Act failed. As the movements continued to persist, it was not until 1976 that substantial progress was made. President Park Chung-hee passed a series of laws to provide coverage to various groups. The first key consideration was funding the system. The government decided on a contribution model that included both insured individuals and government subsidies. Another key consideration was eligibility and implementation. The government decided to start with a gradual rollout. In 1977, the South Korean government passed the Health Insurance Act, which would serve as a legal basis for the National Health Insurance Program. This mandatory social health insurance was introduced for employees in large firms with more than 500 workers, initially covering 8.6% of the population. This allowed the government to manage and monitor the system before expanding to the other group. The process was gradually expanding coverage over time to different groups. In 1979, insurance coverage was extended to government workers and private school teachers. By 1981, self-employed individuals were included in the coverage. From there, throughout the 1980s, coverage extended to small businesses and eventually included farmers and fishermen, who were previously marginalized due to logistical and economic challenges. The government subsidized premiums and developed regional health insurance cooperatives to integrate the self-employed in rural areas. Finally, in 1989, universal health coverage was achieved as urban residents were brought into the system. This remarkable transformation from the initial law in 1963 to universal coverage in 1989 was the result of persistent efforts by healthcare workers, activists, and progressive political forces. It demonstrated South Korea's commitment to take responsibility in securing the right to public health and set the stage for further developments in the country's healthcare system. Here's a video of interview from a man named Kim Dong-soo, who actually lived during when the first NHI was in progress.
이 아파가지고 이거 하면 이제 집에서 그냥 아프다가 죽어야 돼. 아프면 죽어요. 그래서 아까 얘기하잖아. 평균 수명이 45에서 뭐 50세. 그래. 그러면 50세면 다 할아버지라. 요즘 50세 장기 시방 간 사람도 많잖아. 장가 가고 싶도 안 간 사람도. 50대는.
Thanks to a kind and generous old man named Kim Dong-soo for the interview. Like what he said, there was no possible way to get a proper medical system at the time. Also, thanks to the NHI for making able for us to mend the better and advanced technology of the medical changes. As the expansion of the NHI system in Korean territory was established in 1989, the NHI officially started making its global appearance and gained recognition starting from the 2000s. After seeing the NHI's efficiency and its positive influence, the World Health Organization ranked South Korea among countries with highly efficient healthcare systems. This acknowledgement emphasized the NHI's success in providing equitable access while controlling costs, serving as a model for other nations. South Korea began actively engaging in international health cooperation programs. As the United Nations adopted the Sustainable Development Goals in 2015 with UHC as a key target, South Korea emerged as a leader in advocating for fair and justified health systems. South Korea shared its expertise at global courts like the World Health Organization, Assembly, and through partnerships with countries seeking to copy its model. South Korea's health policies are frequently studied by international scholars, and its NHI system has inspired reforms in countries like Thailand, Vietnam, and Rwanda. The country continues to provide technical assistance and policy advice to organizations like WHO and OECD. South Korea's National Health Insurance (NHI) system has not only re-voluntarized healthcare within our own community, but it also has become an alert of hope for countries that is aiming to achieve universal health coverage. The NHI, in collaboration with national organizations like the WHO and the OECD. Countries, for example, Thailand, Vietnam, and Rwanda, have used South Korea's model to improve their country's healthcare system and make sure that everyone can get the care they need, even if they do not have more money than others. By sharing their experience in health policies and how to help healthcare, South Korea is making healthcare more fair around the world. South Korea's efforts are helping the world move toward better healthcare for all, showing that everyone deserves access to medical care. As countries work to reach the United Nations goals for better health, South Korea continues to lead the way, providing that healthcare can be fair for everyone. South Korea's national health insurance has made a big difference, and its impact will keep growing as more countries work together for better health.